Today, the World Health Organization warned that the Zika virus is spreading explosively. By the end of the year, it could infect 4 million people. It's in 23 countries now, including the U.S., with 31 cases in 11 states and D.C. since last year. So far, all of the patients here were infected by mosquitoes abroad, but that is likely to change. The virus, first discovered in the Zika forest in Uganda in the 1940s, is linked to serious birth defects. Dr. John LaPook has the latest.
The Zika virus was...
Today, the World Health Organization sounded an alarm about the Zika outbreak. Director Margaret Chan.
Questions abound. We need to get some answers quickly.
The organization will convene an emergency meeting Monday to plan its response. The Zika virus, which is linked to children being born with small heads, poses several challenges. Right now, diagnostic tests are imperfect, there's no treatment, and there's no vaccine.
As the Secretary said,
Dr. Anthony Fauci, head of the infectious diseases branch of the NIH, says the outbreak is a pandemic.
You have multiple countries in South America and in the Caribbean, so by anybody's definition, that would be considered a pandemic.
There's concern the virus will eventually be found in mosquitoes in the U.S.
If you have this much Zika in South America and in the Caribbean, sooner or later we're going to see a local transmission.
Fauci says controlling mosquitoes that could carry Zika is key, and the United States has one big advantage.
Most of the United States goes through a real winter, and that's very, very important in containing mosquito-borne viruses.
35-year-old Ana Palazzo is pregnant with twins. 2 months ago, she cut short a trip to Brazil and returned to New York.
I want my babies to be safe, and I was very anxious about it. I didn't feel safe there.
Dr. Fauci says we're not likely to see the same widespread Zika outbreak here in the U.S. as in Brazil. We can better control mosquitoes, but Scott, there are a lot of unknowns, and the healthcare community is watching this very carefully.
Dr. John LaPook, doctor, thanks very much.